Hai semua, terima kasih sebab tonton video Celoteh Dr Malar sekali lagi. Ramai yang ada inbox message saya bertanya berkenaan dengan masalah kesihatan bayi you all sebab you all macam gelisah risau dalam pandemik ni kalau nurse suruh pergi hospital untuk cek kuning ataupun suruh pergi klinik untuk cek kuning. Perlu ke pergi doktor? Tak boleh ke saya duduk rumah je? Kuning ni takkan baik dengan sendiri ke doktor? Takutlah nak pergi hospital musim-musim lockdown pandemik ni, takut pergi sebab kuning balik sakit lain pula. Okey, saya faham kerisauan dan kegelisahan anda, tapi anda juga perlu faham apa itu demam kuning ataupun jaundice di kalangan bayi, apa maksud dia, apa jenis-jenis dia, dan apakah masalah berkekalan ataupun masalah jangka panjang yang mungkin you wujud, bukan semua baby lah yang kalau kita tak rawat on time, apakah komplikasi ataupun masalah jangka panjang yang mungkin wujud. Itu yang you all kena faham. Jadi untuk menjawab persoalan itu yang sebenarnya di dalam disiplin pediatrik, saya dah jemput seorang pakar pediatrik, Dr. Kenneth, untuk tolong jawabkan. Alright, jom kita dengar.
Basically, jaundice is something so common, very common. Almost all babies have it. So, and parents usually get very worried about it because I think they would have read somewhere that high jaundice is actually very dangerous to the baby. So, which is actually true. Now, jaundice is what we see when the baby is having yellowing of the eyes and also the skin. So, when the jaundice happens, it usually starts from the eye. In babies, it's pretty difficult to see because they are sleeping most of the time. So after eyes, they go to the face and it goes downwards. So basically, the lower down it goes, the more severe the jaundice is. Now it can happen at any time from day 1 of when the baby was born up to day 3, day 4. So, but the earlier the jaundice happens, the more dangerous it is that we have to be more careful. The substance that causes jaundice is called bilirubin, and bilirubin is formed when your red blood cell is broken down. So in normal condition, bilirubin has to be processed by our liver before it is being excreted out from the body via your urine and also your stools. So, but the problem comes, baby are just born, the liver is immature. So they cannot handle that much of bilirubin. So when you have a lot of bilirubin waiting to be processed and the liver has the capability of the liver is limited, then you get accumulation of bilirubin, and this causes what we see, jaundice. Okay, so this is called physiological jaundice. Happens usually about day 2, day 3 of life, going up until day 7, day 8, then it will slowly go down. The second group of jaundice is actually called pathological jaundice. So generally, if it happens within the first 24 hours of life, it is always pathological. Usually the jaundice builds up much faster. So you will see the jaundice going up very high, and when the jaundice is very high, you do see symptoms faster. So symptoms include very yellow jaundice baby. The baby might be excessively sleepy, not sleeping all the time, not drinking, not active, passing very little urine and passing stools very little. Or it can also be the other way around, the baby is crying all the time because of the jaundice is too high. That is also possible. Jaundice within the first week of life, if the bilirubin level is too high, it can actually cross our brain. If it crosses the baby's brain going into the brain, then it damages the brain. And when it damages the brain, the damage is permanent. So this is of course something that we would want to avoid. So that is the reason why we have to be very careful in monitoring the baby's jaundice level and the symptoms to make sure that it doesn't go to that level. Now, physiological jaundice, as I mentioned just now, it is part of a normal physiology, so you can't really do anything to avoid it. But what you can do is to avoid high jaundice, to avoid what the bilirubin level to go so high that it damages the brain. So what I usually tell parents to do is, first thing is to make sure the baby is feeding well. So how about how much of feeding? It depends on the baby's at which day of life, but generally if you are breastfeeding, the baby should be able to breastfeed about 15-20 minutes and able to pass urine about 6 to 7 times a day. And the color of the urine should be clear like water, because we know that bilirubin is excreted from the body via the urine and also the stools. If the baby is not drinking well, they get dehydrated, they don't pass out urine, the bilirubin are not excreted out, it builds up in the body, it can go scarily high. Then some of the convalescent centers like Beyond 28 have what we call a transcutaneous bilirubinometer. So it is pretty much like a machine that you are scanning for your temperature. Everyone is very familiar with the infrared thermometer. So you scan and you get a reading. So the guideline recommends that if the jaundice level goes up higher than 200, then it will be necessary to perform a blood test to confirm the level of the jaundice. So there is a table from our Malaysian CPG guideline saying that what is the level of the jaundice that requires phototherapy. When it's high, then we need to refer the baby for blood test to confirm, and if the blood test is really high, then you have to go to the treatment which is usually phototherapy. Well, phototherapy is a form of treatment for jaundice. It's the mainstay treatment of jaundice because the photo light at a certain wavelength, usually blue lights, can effectively bring down the jaundice level. So, but the thing is, the photo light, although we always say it's very safe for the baby now because most are LED lights, it is still not without any risk. So it should be done in a medical center or a hospital where the nurses are trained to use the machine and the doctors are there to monitor for the baby. So I still think that if a baby requires phototherapy, they should be referred to a medical center or a hospital for proper, good quality phototherapy. A lot of times parents are very worried about jaundice, and some may even go to the extent of blaming themselves for why their baby is having so high jaundice. Is this something that they have done? Is this something they've done during the pregnancy or maybe during delivery that caused the baby to have such high jaundice? Now most of the time it's not the fault of the mother. So I think the mothers should need to not to be too harsh on themselves regarding the jaundice. Talk to your doctor first to make sure that you understand the condition of the baby. The most important thing is to make sure the baby is safe, getting treatment if the baby requires, and can be in a safe place with proper monitoring so he doesn't go into problem.
Dah dengar tak apa yang Dr. Kenneth cakap? Jadi saya rasa dengan perkongsian ilmu daripada Dr. Kenneth ni, ibu-ibu di luar sana yang sedang berpantang, yang baru bersalin, boleh dapat lebih orang kata tip sikit lah, pesanan sikit dan faham dengan lebih baik berkenaan dengan masalah bayi anda, dan you all boleh buat keputusan yang lebih sesuai untuk anda, bayi dan juga keluarga. Saya faham Dr. Kenneth cakap dalam bahasa Inggeris. Jadi kalau ada apa-apa nak tanya, kalau ada apa-apa yang perlu penjelasan, boleh tanya di ruangan komen, nanti Dr. Malar tolong jawabkan. Kepada semua ibu yang berpantang di luar sana, take care dan stay safe, stay healthy di dalam pandemik ini. Bye.